got a plan, no need to fret. Found a way to help that you won't forget. Doctors lost the answers, but she found the key. Empowering ladies, setting us free. Battle in the storm with courage and grace. Shayna's got the wisdom to help you embrace. No more relying on pills they don't know. She's got the strength to help you grow. Feel the power rising inside. Shayna's guidance right by your side. Life's getting brighter step by step. With Shayna's touch, you're gonna prep. Feel the power rising inside. Shayna's guidance right by your side. Life's getting brighter step by step. With Shayna's touch, you're gonna prep. Medicine shelves are emptying out. Finding real strength, that's what it's about. No more prescriptions tying you down. With Shayna's help, you'll wear the crown. Ladies, hear the call, it's time to rise. Shayna lifts the veil, opening eyes. No more shadows breaking your day. With her wisdom, fight pain away. Broken paths don't mean you're lost. Shayna shows to bear through the cost. Healing hearts one smile at a time. With Shayna, you'll shine forever and feel the power rising inside. Shayna's guidance right by your side. Life's getting brighter step by step. With Shayna's touch, you're gonna prep. Feel the power rising inside. Shayna's guidance right by your side. Life's getting brighter step by step. With Shayna's touch, you're gonna prep. You're gonna prep. Ladies and shelves are emptying out. Finding real strength, that's what it's about. No more prescriptions tying you down. Shayna's help, you'll wear the crown. I've been waiting all my life for someone like you, like you. I would watch the days go by, wasted and blue. I was out of use. Now every day, every night, every moment with you, I'm walking on air. And every day, every way, I feel like finding the strength deep inside. Shayna Melissa takes us on this ride, from suffering to a life so free. Her healing touch, she'll set you free with a heart.
Hey, 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 my fellow nurse practitioners, nurses, and other healthcare providers out there. We have a very special guest. Stay tuned. We're going to talk all about educate, advocate, evolve, and more. How to get involved, how to be a member, the perks, the benefits, special savings, upcoming events that you're not going to want to miss. And we have a very special guest. I am Shayna Melissa Stockman, a fellow nurse practitioner for 30 plus years, who empowers mostly ladies to get and feel better while reducing their signs, symptoms, autoimmune flare ups, and need reliance from medications. And before we get started, I just want to share with you a complimentary daily dose of positivity. There is so much negativity in this world, and the news is often all about violence and bad things. I want to share the positivity. So, right there, if you'd like to claim your daily dose of positivity at absolutely no cost, just scan that QR or go to worldwellnessexpert.com/30 days. That's going to give you 31 beautiful screensavers with another inspirational, motivational, or transformational message every single day to retrain your brain and reset the mindset so that you can be more positive. All right, now I would like to introduce to you a very, very special guest. We have with you Mr. Bryan Lovejoy, fellow nurse practitioner with way more initials after his name than I. He is also he is also a board certified nurse practitioner, well seasoned, and the president of the Nurse Practitioner Association Long Island chapter in New York, Region 7. He is so absolutely amazing. Bryan Lovejoy is a nurse practitioner with Northwell Health. He floats mostly through telemetry, med surge. His initials include DNP, AG, ACNP, BC, FNP, BC, and more, the whole alphabet. He is a leader as the nurse practitioner of the Association of Long Island chapter. Through his work with Nurse Practitioner Association of Long Island, he helps advocate, advance our professional development and collaborations amongst nurse practitioners across the entire region. Bryan is passionate about strengthening the role of nurse practitioners in healthcare and supporting initiatives that improve patient care and expand opportunities for our
Hi,
to be
Shayna.
here. Hi, how are
So
you
thank you for
doing
that warm
today?
introduction. I'm good. Thank you for having me on the show. I appreciate it.
You're welcome. And I am so glad to have met you. You know, I finally met a nurse practitioner with more initials after the name than myself. And I also wanted to share with them because I just found this out about you and I did not know. When you guys remember when the pandemic first hit Long Island and they had that ship out in the ocean that they wouldn't even let dock in New York. And I want to let the viewers know that Bryan was one of the people that just hopped on that ship and said, hello, I will be helping those people. So thank you for that. Can you tell us a little bit more about that?
Yeah, sure. One of my other hats I wear is I'm part of the National Disaster Medical System. So I've been doing that since I was an ER nurse, actually. And every now and then I'll deploy to disasters. So usually I'm on call about 2 months a year. And when there's some kind of emergency, my team might get deployed if we're on the on-call list. Um, Usually what we do is we end up going to hurricanes and things like that. That's the
Oh,
norm. This particular month, I was on call in March, so I was actually expecting it to not really be a busy month. A lot of times when you're on call in March, you're not expecting to go out. If you're on call in the summer, you do. And I was on call and the pandemic had started. So they had the Grand Princess that was out at sea at the time, and they had called us to go help people on the Grand Princess. So
wow.
pretty much, I went with my team. We joined up with the Coast Guard. We boarded the vessel offshore, and we were basically performing rapid triage and medical assessments of passengers exposed to the virus, and it was really long. It took about 12 hours before we even got to the ship, and then we worked all through the night. So the whole thing took probably about 36 hours. We had to put on PAPRs at the time when we boarded the ship because those were the safety measures we were taking. This is before we really knew what COVID was or how infectious it was, so we took all the precautions.
Yes. Wow, that's absolutely amazing. I remember in February of 2020, I was coming back from Cancun and they said it wasn't here yet. And in hindsight, that winter before February, in January and December, I was running an ER as like the highest practitioner there. And there, it was definitely there already, although we didn't know what it was at the time. It was definitely there because my patients were negative for rapid, they had all the signs and symptoms, but they were negative for rapid strep A, strep B, mono, everything else. Cultures came back negative and they had all of the symptoms. So I was seeing it probably before you were on the boat.
Yeah, yeah, exactly. Like, and that's what was interesting about it. Like, it was showing up in communities before we ever knew, because it presented like
Mm,
other viruses, and it was very hard to tell that we had this novel virus kind of going on amongst us. We saw a lot of it in China at the time. That was the information that we had, and I guess the policies at that point in time were to try to keep COVID offshore if possible. So that's why the mission ended
yes.
up taking place that way at sea.
Yes, but I have a feeling it was on my plane ride home from Mexico, just so you know. It really was. And I wanted to share a couple of photos we have because I guys drop us, those that are tuning in, we see the eyeballs on us. Please drop hearts, comments, follow, drop us where you're tuning in from. This is live and interactive. So if you have a question for Mr. Bryan Lovejoy, he'd be glad to answer. I think he'd be glad to answer it while we're live. We could stream it across the screen. So we'd love to see your comments, where you're tuning in from. And I dug up some photos. I think this one, oh yeah, there we are. Now we got, well, guys, want you to know, especially if you're not a member of the Nurse Practitioner Association, join. There we are, lunchtime, having like tea at high noon. That was a very fun event. I had never been to a tea party like this before. And
Yeah,
then we,
this was a great event.
yeah.
I was gonna say, like, a lot of the benefits of the NPA, one of the main ones is really this professional community and just being able to meet nurse practitioners from different walks of life, continuing
Mm,
education sessions, advocacy, that sort of
yes.
thing. And when we go to an event like it was the Mad Batter Tea Party, right? That's where we met.
Yes, yes. Well, no, we had
Yes.
met before that at an annual CEU event when
Oh,
we
yeah,
got
one of the
our
pharmacology
pharmacology
conferences.
credits. Yeah, so we have those events too, where we're gaining pharmacology credits. Yeah.
Yeah, so continuing education, basically these events, we have practical clinical education that nurse practitioners can immediately apply in their daily practice. So we'll have expert speakers come and they'll talk to you about clinical pearls and wisdom and
Mm.
the science is constantly changing, so it's good to go to these lectures to get the best evidence-based practice and so you can know how to treat
Yes.
your patients the right way.
Yes, and I think it's so important for them to go live in person versus virtually because I know sometimes I learn the most from a speaker on my private conversation with them before and after their talk. That's where I gain some of the gold nuggets as well.
Absolutely, and this is really part of being part of that professional community. Like we met at these events, and we're in very different
Yes.
areas in nurse practitioner land. Like I'd never met anybody that did podcasts as a nurse practitioner, so I thought that was very interesting and unique.
Oh. Thank you, and thank you for being on your very first live. Congratulations for that. And
Yes.
look at the. Oh wait, can we go back to that food? Woo! I love the. We get to eat good food too. That was like sushi and caviar and shrimp and beautiful displays of salad, even their desserts. Woohoo! And then yeah, so we have good lunches, dinners. This was another beautiful dinner. There is Tara. Tara does so much for our organization. Shout out to Tara for all she
Yeah,
does.
absolutely. Tara's great. She organizes all kinds of events. Recently, she's organizing a hockey event actually, so there's still time and seats left for that
Yes,
if anybody wants to sign up.
yes, the Islanders, New York Islanders. You could see in this next photo, she also organized this Ducks game. That's the Long Island Ducks, the farm team for New York, and that was a lot of fun. And this was one where that was one where you can bring your family. And then this one here was us, the nerd. Oh wait. um, yeah, this one here was, I think Tara also organized it. It was this past year on City Field. All the nurse practitioners came and we got to go onto City Field. And some of them are geared for us to bring our family. So if you have a little one, a spouse, a significant other that's being left out at times, some of these events are inclusive of the family too. And like Brian says, the one coming up is for the Islanders. So if they like hockey, that'll be good.
And that's a good one too. And like you said, it's good to be able to bring your family because sometimes, especially if you have young kids, it's hard to get them watched. So we set these events up so you can kind of bring your whole family with you and just have a nice family time, a nice time with other nurse practitioners.
Yeah, and I would have never expected. Can we bring up that City Field one again? I would have never expected that I can get onto City Field. So that was pretty cool through the organization. Those are all our fellow nurse practitioners that came to this event. It was a rainy day. We got onto City Field. It was a lot of fun. It was a ball game. It's, you know what, fellow nurse practitioners work all the time. We are 24/7. We don't stop, we don't eat, we don't sleep, we don't even stop to use the restroom, so that we can just stop and breathe. And Brian, you, this is something you might not know. Kristen there, at the Mets game, told me, she goes, thanks to you, I became an RN nurse. I was the one that inspired her to become an RN, and I had not known that. So
Oh,
that
wow.
was, yeah, that was pretty mad cool. She told me during the ball game. I'm like, I had no idea. She was already an LPN, but I remember telling her, "Listen, you are so smart. You need to do more." I love my LPNs; they are great too. But I knew that she could do so much more than that. So at that event, she thanked me for inspiring her to become an RN.
And
And I want to give her a shout out because she also got NP of the year this past year.
yes, she did. Congratulations, Kristen, if you're out there.
Yay! And can you share with us some of the other perks? If there's nurse practitioners out there and they're like, you know what? I don't know. Why should I be a member? Like, what would you tell them?
So, like we were just talking about, one of the main ones is the professional community. And as you were just saying, you got to hear that nice story about how someone became a nurse because of you. And I feel like we need to hear stories like that sometimes. And when you go to these events, you get to meet people in different walks of life. Like when we were at that Mad Hatter Tea Party, one of my former teachers from Malloy came over, who I hadn't seen in like 20 years. And it's like, oh, I remember when you were one of my students. And it's just so nice to see people in different parts of their career. The other main thing that we do is advocacy for nurse practitioners. So that's really essential because healthcare policy directly impacts patient access to healthcare. So making sure that we're able to practice at the top of our abilities, we do things like Capital Day, which we're actually doing this week up in Albany. That's where we meet with different legislators and we try to make sure that the Modernization Act is in place and other legislation that we might need. And then besides that, we do continuing education. And, it's actually a good opportunity also to learn leadership skills. So when you join, we
Mm,
have all sorts of committees that people can join. And that helps you to learn a lot about leadership. Like, for example, we're doing the annual conference, which will be coming up soon. Sharon's the committee chair there. And you get to learn how to run an event, which is totally different than your normal everyday clinical experiences. As I'm sure you know, Shayna,
yes.
running events has a lot of logistics and things that you learn about leadership and delegation and just responsibilities.
Yes. And also even just mentoring, because like it's so cool that now to see years later, actually Kristen and I reconnected, I believe, at one of the membership meetings, and that's when I found out, and I had no idea all these years that she was a nurse practitioner, that I was the one to encourage her to become an RN nurse, which was like I didn't know. So it's nice, like, your story, my story, to reconnect. And I reconnected with people from Stony Brook. I graduated 3 times from there in the 90s. So to still see them coming to our events is pretty cool, and what they're up to lately. Yay.
Absolutely. And I would
Oh,
say that that's one of the big benefits.
yes, and this is our beautiful website, thenpa.org. If you were a member and want to become a member again, or you let it lapse or whatever, thenpa.org. Please put the THE in front of npa.org.
Mm.
And way at the top, you can click member and rejoin or join, or you can click education and find out all of our upcoming events, and maybe even join us at the next few that we have going on.
Yeah,
Yay.
absolutely. We'd love to have everybody there.
Yes. And that photo, I took that screenshot this morning actually, and I saw that they're having, yes, NPA of the year, student NPA of the year nomination. So if you know an NP student and you'd like to nominate them, please go to the npa.org. And Brian, I don't know if you knew this, but I was nominated for NP of the year, Long Island and State this year.
Really? I didn't know that,
Yes,
actually.
yes,
Oh,
yes, yes. Yay! Hey, if you think I'm worthy, put a good word in. Not Brian, but whoever the speakers are that are out there. I don't know, whoever's listening. So I'm so blessed to be nominated by a fellow nurse practitioner. Um, I've been a member since the NPA Association since 1997, when I was a student right before I graduated with my
okay.
postmasters.
So you joined as a
So
student, which is when I joined also.
yes,
I think that's a great time to get students involved, and then usually you become a lifelong member once you start at that time because you
yes.
you see the benefits of advocacy and community.
Yes, and as students, you guys get a discounted rate. So there are certain discounts, like if you are a student. And also, when you join, I believe you get discounts on like our dinner events, our CUs, our annual. You get it cheaper than the non member price. And also, you get discounts on the National Association as well as your malpractice insurance.
Yes, that's through the NSO. They give a discount to members. I think it's
Yes.
10%.
Yes. Hey, whatever it is, we'll take it. It's good.
Absolutely.
Yes. And what would we like to talk to them a little more maybe about the upcoming event? And Brian, would you like to share? Oh, here's some pictures I dug up from almost 365 days ago. There's our beautiful Tara and some of them at the beautiful Crest Hollow. It will be again there this year. It is gorgeous. And then I reconnected, like you, Brian, with people I had not seen since the college days, a long time. The Crest Hollow, I believe it's, yes, the Crest Hollow in Woodbury, New
Yes.
York, is beautiful. Look at even just the lobby. It is gorgeous, right?
Yeah, this is really a great day. So this year we're doing it on April 24th. Again, like you said, it's going to be at the Crest Hollow, and you go there in the morning. We have breakfast, and we have a whole socialization in the morning, and we have different vendors there talking about their products, and then we go into continuing education. And you're actually going to be one of the speakers this year, Shayna.
Yay! Yes, I will. Thank you. I'm so glad that I'm going to give a talk. My talk will be titled Autoimmune Alert, Decoding Your Body's SOS Signals. Now, after Brian, ding, time's up. We're going to start off. They're going to have breakfast, registration. Our president of the NPA Long Island chapter, Bryan Lovejoy, will be welcoming everybody aboard. And then I will be giving my talk all about autoimmune disorders. I think it's important because, and I'm blessed that the NPA Association is letting me give this talk because when I went to school, Stony Brook was a great college, but they never prepared us. None of the colleges really prepared the nurse practitioners enough about autoimmune disorders. People don't realize it's a leading cause of death amongst young to middle aged women, but so are the prescription drugs used to treat them. So I want to enlighten my fellow nurse practitioners how they can recognize early signs and symptoms, early test results, because I find a lot of patients come to me have been suffering for years going to the doctors and specialists. And then I also want to enlighten them about medication so you can get your farm credits and your CEUs, about contraindications, cautions, side effects, um, attacking the root causes, the true root causes, naturopathy, healthier alternative options, and so much more. So thank you, NPA Long Island, for allowing me to speak and educate my fellow nurse practitioners. Brian, I'm passionate about it because I find that the doctor gives doctor's orders to the patient. You do this, where I like to educate my patients so that they can truly make an informed decision. Because the only way they can truly make an informed decision is if they are aware of all available options. So now I figured if I enlighten my fellow nurse practitioners, we can create a deeper impact. Because when I impact a patient, that's good. But when I teach my trailblazing techniques to a fellow nurse practitioner, each one of them could impact 1,000 lives that year between friends, family, and patients. So if I teach my trailblazing techniques to 1,000 practitioners and they each impact 1,000 lives, that's 1,000,000 lives impacted. And that's the kind of impact I want to create.
Yeah, so it's like you said, it's important to collaborate. And I guess overall, ultimately, the most important question in healthcare is really what actually improves patient outcomes, right? So you look at the
Yes.
outcome, you try to see how you can improve them. And you have a very unique, specific patient
Oh,
population.
oh, okay. Oh, just so you know, the guys that are, for you guys coming, I'm going to donate a raffle basket, and it's going to include a copy of my book, Overcoming Life Obstacles, where I shared biohacking and how I did what I did. And for the viewers that don't know, I had multiple autoimmune. I was blown off by the doctors. I had to diagnose myself, treat myself, heal myself. Then some of my former doctors became my clients. So there's going to be lots of raffle baskets there, like I don't know, tons of them with really cool prizes. Mine's going to include a copy of my book, some other cool merch, and I got permission from Kudos Magazine to include all 24 past issues that I collaborated with them in the magazine, which I think, thank you, Kudos Magazine. And yes, and in the magazine, it's digital. It's you can click and see quick, easy, healthy recipes where I'm actually making them in my kitchen. Oh, that was book signing. That was one of my last big talks that I did book signings after people want personalized signed copies, photo ops, and things like that. So thank you, thank you, thank you. And Bryan, can you tell us how you became president? Like, you didn't just nominate yourself, right? Like, what happened there?
No, no. I was asked by colleagues. I had been a part of the Nurse Practitioner Association since I was a student, just like you were saying, and I was
Oh,
involved with some of the, with Sharon a little bit with the conferences, and then people had just asked me if I would be willing to be president. So I accepted the nomination and I just went from there.
that's pretty cool. Now, also, like me, you are also board certified. Can you explain to people that might not know the significance of a board certification?
So it's nationally recognized, and it shows that you have a certain level of competency. So that's why it's really important to have.
Mm,
Specifically on Long Island and a lot of our healthcare institutions here, it's a requirement, but technically in the state it isn't. So if you're practicing in big institutions, you typically will need it. If you're practicing independently or alone or with a local doctor, you might not, but it's still important to have, I
mm.
would say, either way, just
Yes.
because, yeah, it shows that you have that competency that you need to take care of patients.
Yes, it shows we're up to not just our state standards, but national standards where we took a test, passed the test, and then also for the viewers that don't realize it, if you are going through nurse practitioner school now, you might want the certification because it's going to help you get a job over somebody else. Like you said, some of the employers are requiring it, some of the insurance carriers. But also, when we maintain our national board certification, in order to maintain it, we have to prove to the board we are in excellent standings with the hospitals, with the insurance carriers, with our criminal records, but also that we're keeping up on our education with the latest and greatest because medications are always evolving. There's always new treatments. So showing that you're current with your board certification means that you prove to the national board that your criminal record is good, you're not in trouble with the hospital, the insurance carriers, but more importantly, you are up to date with all your continuing education, including everything from infectious disease to recognizing child abuse to pain management and recognizing addiction and how to correctly refer it out.
Yep, it's very important, Shayna. Thank you for
Yay.
mentioning it.
Yes, and I'm so glad that you are board certified as well. Now, you are also a family nurse practitioner because when I went to school, they didn't have family. So I got my adult nurse practitioner and I went back postmasters and got a second certification license for my pediatric nurse practitioner.
So for me, I went for family because it was available, and I figured it was the broadest thing that I can go for, where you're
Smart.
taking care of pediatric population and adult population. I later went on for the acute care because I'm basically hospital focused at this point. And
Yes.
also during the period of COVID, I was sent to the COVID ICUs, and I felt like since I was going to be doing some sort of ICU care, it'd be nice to have the formal education at the end of the
Yes.
day. So I ended up going back for that certification too.
Oh, wow. That is awesome. Awesome. Thank you. Thank you. Thank you for doing that. I don't find a lot of nurse practitioners. I mean, there are some that do dual certifications or dual licensures, but not quite a lot. And, I realized when I started with the NP Association, just so you guys, to give you the viewers a better idea, most of the patients back then in the 90s when I first became a nurse practitioner, they didn't know what a nurse practitioner was. They were like, no, I don't want to appoint with you because I need prescriptions for my medications. I'm like, so I actually put on the back of my business card the definition of a nurse practitioner. So for the viewers that might not realize it, the step ladder is like this: LPN, registered nurse, physician assistant, nurse practitioner. Now, people might think physician assistant is hired to the doctor because of the title, sounds next to the doctor. But up until the past few years, the PAs used to only need a bachelor's degree, where the nurse practitioners all needed at least a master's and all had to be registered nurses first and show that they were in the field.
So when it comes to PAs and MPs, I mean, at the hospital
Similar.
level, we do a lot of collaboration, which is great. I love working with my PA colleagues and collaborating.
Mm,
When it comes to the ability to do independent practice in the state, nurse practitioners
yes.
do have that practice authority, whereas PAs do not. They still, at this point, need to have a physician supervising them. And I think actually they did a movement recently where they changed their name. They're trying to switch more towards like physician associate. Um, and they're trying to get that independent practice if they can, but at this point in time, in New York
Yes.
State, it's not something that they have. So that's one of the
Yes.
main differences.
I think it would be, yeah. All right, I want to go there, but I think LPN, RN, PA, NP are similar in certain ways. But you brought up a very good point that the PA currently needs supervision, where a seasoned nurse practitioner does not. A new grad nurse practitioner does, but not a seasoned graduate. And also that it varies state to state. I think that's an important point to mention.
Yes, it does. It varies state to state. If you're practicing in other states, you have to get a license and practice to whatever their state authority is. And I've run into this sometimes on deployments too. Like if you're in a state like Texas, you're not allowed to practice independently. Now that's
Oh,
superseded sometimes with federal law if I'm deployed to a disaster, but that's not something that they culturally like.
yes. And it's recently I met with the politicians to discuss about the sundowning of the Modernization Act, I believe. And that's where the nurse practitioners years ago fought to get independence, where we don't need the collaboration of a physician when we're experienced. And I know that was due to expire. So I recently met with politicians to see if we can get that renewed. So that, because you know what, after practicing as a licensed nurse practitioner for over 30 years, if that act expired, I might suddenly need supervision by a doctor, even though he's a brand new grad and doesn't have the 30 years experience I do.
And very importantly, that would decrease access to healthcare for certain people in that community that might not have another provider that they're seeing. So that's one
Yes.
of the things. We're trying to expand access for patients ultimately to see
Yes.
healthcare
Oh,
providers.
oh, I also want to enlighten people about the upcoming schedule for. So this annual event is. Oh, okay. There's the beautiful Kudos magazine. Whoever wins my basket is going to get 24 issues, access to it, and it's digital and it's clickable, and there's lots of videos inside, healthy recipes to save you time, save you money. Oh, okay. I'm gonna quickly talk about this. Kudos magazine is giving a care back to the community, a give back. There is absolutely no cost to this event. It is tomorrow. And thank you, Kudos Magazine, for allowing me collaboration with you inside your beautiful magazine for the past 24 editions. And thank you, Kudos Magazine, for doing this give back to the community. There's absolutely no cost to join. This is nothing that they're selling from there. Anyone can join. It is giving back. It is for caregivers. It could be caregivers who are nurses, nurse practitioners, or caregivers of family members. This is our time to care for you. We're giving back to the community. The event is tomorrow, 12 to 3 p.m. EST online. It is no cost, no upsell from there, but you got to register so you get the link. There's the QR code, or you can just go to kudoscaregiver.com. I am one of the featured speakers. I will be talking about a little bit about autoimmune, but about not stress management, but stress reduction in our busy lifestyles, taking care of the world, the mom, the child, and the spouse. How can we also do self-care and take care of ourselves? There's going to be other speakers in there. Abraham Law is going to talk about estate planning and wills, and Abby Park is going to be talking about safety for long-term care facilities. Dr. Robert Bouvier is also going to be talking about tracking with a special app. Sheriff Chris Swanson will be talking about safety in the community. And the beautiful Elizabeth Marosco is hosting this event at absolutely no cost to us. So just go to kudoscaregiver.com. And I hope you catch my talk. All right. And then, there we go. The national convention, too. When you guys join the state and the regional, you'll have the opportunity to also come to our national convention. And there I was speaking just over a year ago. That was at the Music City Center in Tennessee on autoimmune disorders. And I got to hold that Olympic gold from one of our keynote speakers. That was pretty cool. And may she rest in peace, Miss Loretta Ford. This is for you. There she is at 103 years old in Tennessee a year and change ago. I was so blessed to meet her multiple times. If it was not for Miss Loretta Ford, who I believe started the very first nurse practitioner program ever, because she knew
She
the
did.
doctors needed, yeah, she knew the doctors needed assistance and help, and patients needed more.
Yeah.
Yes,
Unfortunately, I think she just passed this year, correct?
yes, yes, she did. This was her at, I believe, 103. I'm not sure if she made it to her 104th birthday, but she did just pass this past year. So I was blessed to meet her. Have you met Miss Loretta Ford before?
I did not. We spoke on a phone at one point. We wished her, like, happy birthday, but, no, I never met her in
Oh,
person.
oh, that's cool. Can you share a gold nugget, what you learned about Miss Loretta Ford or how she started the nurse practitioner program?
When we're teaching, we usually cover her, just the historical elements of it, and a lot of it had to do with expanding access, from my understanding, just for
Yes.
healthcare and advancing practice for nurses.
Yes, I think, and I could be a little bit wrong on this. I believe she was working with a doctor and they needed more care. And then, she could give care above what a regular nurse could because they were just doing like bed baths at the time or whatnot.
Yeah, and
And
wearing the
she
hat.
created this, yes, intermediate role. And I remember at my nursing graduation, we did wear the hat back then. I don't know if they
Some
still do
people
that.
tell me that. They didn't have that at mine, fortunately.
No, really? No, where did you graduate from?
Malloy is where I went for undergrad
Malloy,
nursing.
excellent. I almost taught there. Actually, yes, I remember Pat Hood used to teach there. I don't know if she was one of your professors. I believe she taught at Malloy.
She was at one point, yes.
Oh, wow. Yes, yes. She had asked me about teaching from Malloy, and I think she moved over to Adelphi. And then I was a little bit a hike for me, so I had graciously declined. See, I could have been your professor. I don't know. And I believe Bruzikis was also over maybe Adelphi. I don't know. He switched a couple of places. Okay, and then also I wanted to share with them some of the upcoming events we have. Here we go. So for the annual event, if you come, I believe it's April 24th is the date. And here's some of the speaking topics. We're going to start off with Bryan talking. He's going to welcome us aboard. Then we're going to have my talk, Autoimmune Alert, Decoding Your Body's SOS Signal. This, I believe, is April 24th. I believe it's on a Friday at the Crest Hollow Country Club in Woodbury. So after Bryan's welcome, I will speak about Autoimmune Alert. Then we have Phenotype and Pharmacology and Asthma and COPD Primary Care by Ilana Kavanaugh. Then we have Professional Membership Matters, and you are on that expert panel discussion along with Valerie Fuller, PhD, Susan Marks, love her to death, DNP, and Mary Lou Reddy, love her as well. Then we have a short little break. You guys can check out the exhibit hall. There's lots of tons of vendors. They give away free stuff. You guys can join. Please buy raffle tickets to win the baskets. The baskets are beautiful. There's really cool giveaways, and it supports the Nurse Practitioner Association. And a lot of times, the Nurse Practitioner Association um, donates to other associations and organizations as well. Then we have a keynote speaker, Valerie Fuller, DNP, talking about advancing the role of NPs battling misinformation, disinformation, and how can we help educate the public. After that, we have lunch options, two different options to choose from. One is about migraines and one's about antidepressants with new pathways of treatment. Then we have another break. Then we have Renata Shalizzi, DMP, talking about when caring hurts, identifying and managing compassion fatigue in healthcare professionals. Then we have new hypertension guidelines, What Changed by Colleen Walsh Irwin, another DMP. Absolutely love her. She's got a ton of initials after her name as well. Then we also have pharmacology and learning about POTS and more by Donna. And then I think it goes on even further. Woo! We have a packed day. So hopefully
It
you
is a
guys
packed
buy
day.
some. Yes, yes. And don't worry, we have breaks. We have they have some breakfast there, I believe, like muffins and bagels and fruit and yogurt. And then they have a full lunch. The lunches are beautiful there. They're absolutely gorgeous. If it's nice out, they have a nice back patio. Can we pull up where they can register and join again, maybe? Okay, so please, guys, go to thenpa.org. You can become a member there and you can join our upcoming event right there at the top. You can click member or you can click education. There'll be a drop down with all our upcoming events. And Bryan, we have another couple events. If they can't make it April 24th, which I hope they do, but if you guys join the membership beforehand, you'll get discount at the events as well and special savings. But we also have another couple of dinners coming up. I don't know if you plan on going to Blackstone's or Stellar's on the 24th or the 26th,
I always try
possibly.
to go when I can. Good
Yay!
spots.
So we have, I believe, on March 24th of this month at Blackstone's, we're going to be talking about sensors. Remember those old glucometers are now these little sensors. And Blackstone's is a beautiful steakhouse. I believe in Melville. So if you join before then, you'll get discount on these dinners that are CEU dinners. And then on the 26th, we're going to talk about the Watchman device and left atrial appendage closure at Stella's, I believe, in Blue Point. And I will be at both of those events. I'll be April 24th at this annual event teaching. No, I'm sorry. April, wait a second here. What's the date of the annual event?
It is April 24th. I believe you're
Oh,
correct. I'm double checking.
okay. Yes.
Right.
So I'll be at
Yes.
that. We'll both be at the annual April 24th at the Crest Hollow in Woodbury, New York. And then later in the, this month, it's March 24th at Blackstone's talking about sensors, and March 26th talking about the Watchman device, left atrial appendage closure at Stellar's in Blue Point, and so much more. And oh my God, it is coming to near the end. Would you like to share a fun fact about you that most people may not know? I like doing this.
Fun fact. I guess I have a couple. I've actually been to all 50 states. Do you want to take a guess at what the last one was?
New York. No. Hold on. I don't know. I would guess Hawaii only because it's a long plane ride.
No, it was actually North Dakota. And interestingly enough, when you go there, they have T-shirts in the Tourist Bureau that say "Save the best for last," because very commonly people go there as their last day because it's kind of out of the way. South Dakota people
Oh,
go to, but not usually North Dakota.
wow. That's pretty cool. I had no idea. And one of the authors in my book, one of the co-authors is from, I don't know, what are the Dakotas?
Probably South Dakota.
But you know what's weird is some of his artwork. Scott Jacobs, he's a famous celebrity artist. Some of his artwork sells for $250,000 for one painting, and I'm like, wait a second, shouldn't saving a life that we do every day be worth more than that? Right? We don't get paid enough. We really don't.
As a society, we pay a lot for things like art and concerts and movies and performers relative to people
What?
that are, essential.
Yes, yes, yes. And I'm just looking at all the benefits we get. So advocacy, leadership, CEUs, nice lunches, nice dinners, baseball games, City Field, Islanders tickets, family night out, CEUs. And some of these CEUs, when your jobs give you time off to do a CEU or pay you towards a CEU, maybe make it one of the NPA dinners or the annual event.
Yeah, you can usually use your education fund for some events. Also, a lot of jobs allow you to use your education fund for membership and then paying for different conferences and things like that.
Yes, and I think we also have what else? Student discount. So if you're a student, join now while it's cheaper for you. And I believe that they have a lot of not only that we help advocate for healthcare and safety and the nurses and the nurse practitioners, but I believe they also have a career center, and I think the NP Association has a podcast as well as a journal with lots of gold nuggets and the latest and greatest coming out as well.
Yes, at the state level, we have
Yeah.
some podcasts and a journal, and we also have mentorship programs.
Yes, and isn't the national going to be in Vegas again this year, I believe. And I plan on going.
Yes, it is going to be in Vegas, the national conference.
Oh, I did not tell you. Actually, one of the prior conferences I was speaking in Vegas, Journey had a residency down there. They were playing at the same time. And I don't know how my husband got invited to the gallery debut of the long term drummer from Journey, but hence that's where this painting came from. The long term drummer from Journey, Steve Smith, took neon lights on his drumsticks. And as he was playing, he captured the wavelengths of light while he was playing the song. Hence the
Oh,
painting
wow.
that I got when I was. Yes, yes, this is an original piece signed by him. So it was
That's
pretty cool to see, yeah, his live demo and him playing for us in the gallery debut. And I'm like, I'll take that one and that one. Yeah, it was pretty cool. So do you have any final thoughts as we're about to wrap things up here?
No, I think we pretty much covered everything, Shayna. Just looking forward to having people join up so that we can meet them at the varying events and to expand our professional community.
Yes. And when you guys join your membership and when you come, say, Shayna and Bryan sent me. Please do that. And yes, 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 yes. So thank you, Bryan Lovejoy, for your very first live ever, the president of the NPA Association, for all your time and all, and
Thank you,
all
Shayna.
you. and all you do for us, all of us. And I know these are often volunteer roles that you have. And I just wanted to share the screen one more time for the NPA.org, where they can join the membership or the event. And then I just want to share with them an upcoming event that I have for absolutely no cost. Right there, go to thenpa.org and join the membership or come to any of our upcoming events. The dinner on the 24th or 26th of this month, or the annual April next month. And we'd be glad to see you there. And then also, I have very special events coming up. I have not done anything like this in a long time, and I probably won't after this workshop in a long time. So snag it while you can. There was a wait list. We just opened the doors. Live Reclaim Your Life Super Workshop. It is live. It is not pre-recorded. You could do it from the comfort of your couch at absolutely no cost. Yes, if you don't want the free, there is a VIP option. Scan that QR code or go to worldwellnessexpert.com/reclaim. Mark your calendars. It is live online May 20th. Only those registered will have full access. It starts at 7 p.m. EST sharp. If you level up to the VIP, you'll also get an extra power hour, the digital and printable workbook, and a mini consultation with me for less than you spent on a lunch. Okay, guys? So mark your calendars for May 20th, 7 p.m. EST. Scan that QR or go to worldwellnessexpert.com/reclaim. And we hope to see you at one of these events because they probably won't come around again for another year. Thank you, Bryan. Once again, thank you for the viewers for liking. Please drop a thumbs up, like, subscribe. If you're not a nurse or a nurse practitioner or a caregiver, please share this with someone who is, because maybe they'd like to join the membership, come to our dinner, come to our annual event, or join one of our live upcoming events. Thank you again, Bryan.
Okay, thank you, Shayna. Have a good night, everyone.
Thank you for your time. Yep. Thank the viewers. Thank you, viewers. Oh, look at that. Isn't that cute?